This is a common athletic injury. It is seen at all levels of competition, even among professional athletes. Even though it is not considered a serious injury, it can be very debilitating and can take a long time to heal. In this condition, the big toe is hyperextended, meaning it is excessively bent upwards, thus overstretching the tendon underneath the big toe joint. In addition, the capsular ligament, which is a ligament that wraps around the joint to maintain joint integrity, is also overstretched. And it too becomes painful. Looking at the drawing to my right, the arrow points to the area of the foot where turf toe occurs. Typically, turf toe is seen in athletes who do a lot of running and quick pivoting, such as a running back in football or perhaps a soccer player. It is seen more on hard surfaces like artificial turf, and that's how it actually got its name. This is compounded by the type of shoe being worn. Typically it will be a cleated shoe with a very flexible sole. The athlete will be running along. The cleats are grabbing the ground and keep the shoe planted to the ground for a fraction of a second longer than a non-cleated shoe would. Because the shoe is temporarily stuck in the ground, but the athlete keeps moving, this causes an excessive amount of dorsiflexion at the level of the first metatarsal phalangeal joint. Basically, this means the big toe is excessively bent upward at the level of the big toe joint. If the particular step by the athlete also involves pivoting, this will further aggravates the plantar structures, which are the soft tissue structures underneath the bone, by grinding the soft tissue further into the hard surface. In some cases, this can actually tear the capsular ligament. Some athletes will remember the exact time the injury occurred, and in other athletes, it may be the result of the cumulative effect of playing a game, and they do not really notice it until afterwards. Typically, the patient will complain of pain and swelling in the affected area. There will also be limitation of motion of the great toe. Diagnosis itself is easy enough to make, but an X-ray is helpful to make sure there is no fracture. The sesamoid bones, which are two small bones that are found a little bit further back, should also be examined to rule out a fractured sesamoid. Turf toe is classified according to MRI findings. X-rays are not readily helpful in this situation as they do not show damages to ligaments and other soft tissue. The first type of classification is a grade 1, which is irritation of the plantar plate. The MRI reveals edema and mild strain-like findings to the plantar plate. Grade 2 is a partial tear. The MRI will reveal a partial tear of the plantar plate structure. Grade 3 is a complete tear. The MRI reveals a full-thickness tear to the planar plate. How do we treat turf toe? Obviously, the first treatment is to stop the sports activity. Treatment consists of cessation of the sports activity for 3 to 4 weeks in a young athlete, possibly longer in an older athlete. Next, physical therapy can be very helpful in speeding up the recovery period. Also, anti-inflammatory medication is very helpful to reduce inflammation. This will help reduce the pain to a manageable level. Taping the big toe to limit the motion of the joint is a very effective way to reduce pain and improve the healing process. This prevents the big toe from bending upwards during simple walking and thus helps the damaged tissue on the bottom of the foot to heal quicker. A rigid shoe should also be worn during this time as the rigid shoe will prevent the big toe from also bending upwards. The problem with foot injuries in general is that they take longer to heal than injuries elsewhere simply because just walking on the foot will slow down the healing process. The problem with turf toe is that it can often recur. If you are going to go back to your same sport on the same surface in the same athletic shoe, you are almost destined for recurrence. In closing, it should be noted that turf toe is not limited to the great toe. This condition can happen at the level of the metatarsal phalanx joints, which is the joints where the toes attach to the metatarsal bones. However, it is not as common in the lesser joints.